Bismillahirrahmanirrahim. Question number 45. An 85-year-old man has a history of intermittent lower abdominal pain, diarrhea, and recurrent lower urinary tract infections with coliform organisms. He now presents with history of noticing bubbling in the urinary stream with whistling down my pipe. Which one of the following is the most likely underlying cause of his problem? Intermittent lower abdominal pain and diarrhea, recurrent UTI with coliform organisms. So the options are the diverticular disease of the colon, a carcinoma of the bladder, carcinoma of the sigmoid colon, pneumatosis, cystoids intestinalis, a urachal cyst. The presentation is classical of a vesicocolic fistula with pneumaturia complicating a sigmoid colonic diverticulitis, with a pericolic abscess fistulating into the bladder from a pericolic diverticulitis with adherence between a loop of sigmoid colon and the bladder dome. So option A is correct, which is sigmoid colonic diverticulitis. Means he has a fistula between the bladder and colon. Vesicocolic fistula with pneumaturia. So there is a fistula between the bladder and loop of the sigmoid colon. Vesicocolic fistula due to primary bladder cancer or primary sigmoid colon cancer occur very much more rarely than those due to diverticular disease. So this can be due to a CA bladder or CA sigmoid colon. Pneumatosis cystoids intestinalis is an uncommon condition in which multiple acquired subserosal gas cysts occur in the small and large bowel, usually secondary to obstructive airway disease and emphysema. Urachal cysts are congenital lesion due to persistence of urachal cyst between bladder and umbilicus and usually present as a swelling in the lower abdominal midline, sometimes associated with the urinary leakage from umbilicus. So the correct answer is the sigmoid colonic diverticulitis. There is a fistula between the bladder and sigmoid colon. A 45-year-old man present with a 6-month history of increasing weakness of his right arm and right leg. 6 months history of right arm and right leg weakness. Over the last 2 months, he has had headache, which are gradually getting more severe. The patient reports that over the last 5 years, he has had a number of blackouts which were associated with incontinence for which he did not seek medical advice. On examination, he has a weakness of the right upper and lower limbs. The only other abnormal finding is papilledema. Which one of the following would best explain this clinical picture? This patient, which is 45-year-old, present with weakness in the right arm and right leg, with headache, and which is gradually getting more severe. And since the last 5 years, he had a number of blackouts which were associated with incontinence for which he did not seek any medical advice. On examination, he has a weakness of the right upper and lower limbs. Only other abnormal finding is papilledema. Which of the following would be best explain this clinical picture? A left frontal glioblastoma multiforme, sagittal sinus thrombosis, a cerebral abscess, a left-sided cerebral hemorrhage, a left frontal meningioma. Most of the options they are given a left side, so it means this patient has a weakness on the right arm and right leg, so a lesion would be on the left side. So we have to exclude and choose a base option. So the patient's symptoms and signs of several months of gradually progressive weakness, the right upper and lower limbs associated with ictal seizures, headache, and papilledema suggest a left-sided cerebral compressive lesion of which a sphenoidal ridge, left frontal meningioma is the most likely correct answer. The frontal meningioma. Here we can see the tumor. This is frontal meningioma. And as in this scenario, it was given that patient is having a papilledema also. So this is the picture of papilledema. And this is the frontal meningioma. So this is left frontal meningioma. And cerebral hemorrhages, abscess, sagittal sinus thrombosis would be expected to give a different spectrum of symptoms and signs and are not likely options from the information provided. A cerebral hemorrhage would be more acute in onset. Cerebral abscess would be a subacute in onset, associated with a fever. Sagittal sinus thrombosis would usually be associated with a hypercoagulable state. A malignancy such as a glioblastoma multiforme would tend to give a more rapid progressive of symptoms over a shorter time of period. Means remaining all options are like very rapidly, means acute symptoms will be there, but in this scenario, this in this case the history is very long. So this is the case of frontal meningioma, which is left sided frontal meningioma associated with papilledema.